Welcome to Purple House.
Aboriginal and Torres Strait Islander Australians endure a higher disease burden than other Australians. Chronic kidney disease gives no reprieve, with Aboriginal and Torres Strait Islander people more likely than other Australians to be hospitalised or dying from or otherwise suffering from end-stage kidney disease. As of 2020, Aboriginal and Torres Strait Islander people were around 3 times more likely to die from this condition than other Australians. In addition to suffering the symptoms of the disease, Aboriginal and Torres Strait Islander people in remote communities face the added distress, quite often, of needing to leave their families and country to access dialysis.
Why are Indigenous Australians suffering kidney disease at these higher rates? The 2023 Dialysis and Transplant Registry reported diabetes to be the main contributor to kidney disease in Indigenous Australians, so lifestyle contributing to diet-related diseases. There are genetic factors, with a diabetic marker study finding the Indigenous cohort had lower levels of a kidney protein methylation, which can lead to chronic kidney disease. A 2006 study also found the kidneys of Indigenous Australians were less efficient due to being significantly lower in volume and containing less glomeruli to filter the blood.
Colonisation and genocidal policies certainly also contributed to disproportionate suffering from chronic kidney disease. Racist child removal policies from 1910 to 1970 generated uncountable adverse childhood events and enormous intergenerational trauma for Aboriginal and Torres Strait Islander people and communities. Aboriginal songwriter Archie Roach, through his song Took the Children Away, powerfully voiced the grief of the stolen generations, their families and communities. Felitti and colleagues' research on health and adverse childhood events notes a statistically significant relationship between adverse childhood events and the risk of experiencing certain diseases, including diabetes and cardiovascular disease. Exposure to multiple adverse childhood experiences has a compounding effect on risk. So given the breadth of suffering arising from colonisation and the stolen generations, it is unsurprising that Indigenous Australians suffer from more kidney disease than non-Indigenous Australians.
With a focus on kidney dialysis, which is the intervention provided by Purple House, rates nationally for this in 2021 were reported to be 6 times higher for Indigenous Australians. You can see how much higher the blue line is than the yellow line on this line graph on your right. This disadvantage is significantly magnified by remoteness, which can be seen by the longer green bars at the bottom of the bar graph on your left. It's the social factor of remoteness that Purple House is addressing. The Australian Institute of Health and Welfare reports that 15% of Aboriginal people live remotely, with 71% of these people living in disadvantaged areas. Kidney Australia reports kidney failure in remote areas is up to 20 times more for Indigenous Australians than for non-Indigenous people in a similar area, while the risk of death is double.
Health promotion can include prevention-focused programs and medical treatments that have as their goal enabling people to have control over and improve their health. The Australian Institute of Health and Welfare adopts the World Health Organisation's policy that health promotion encompasses biopsychosocial factors rather than taking a biomedical approach to health. Highly relevant to the goal of closing the gap, the Australian Institute of Health and Welfare endorses the position of the World Health Organization that equity in health is a key aspect of health promotion. That is, reducing the differences in health status and ensuring equal opportunities and resources to all people to ensure optimal health. The Australian Indigenous Doctors Association notes that learning about Aboriginal culture brings cultural awareness, and that cultural safety arises when deep knowledge is respectfully and meaningfully put forward in the service of Aboriginal people. Purple House was set up with cultural safety at its heart because it was established and designed by Aboriginal people living in the Western Desert to meet a need for dialysis and other end-stage renal care that didn't tear people away from country. Purple House is an Aboriginal corporation that is staffed and governed by Aboriginal people. This means that Purple House is also uniquely suited for building on its trusted dialysis program for leveraging trust and bringing Aboriginal people into other health arenas, such as health literacy and receiving primary care. Delivering renal care on country is a highly appropriate health promotion format with therapeutic value independent of medical treatment alone. The Australian College of General Practitioners recognises that cultural connection is central to health and welfare among Aboriginal peoples. So receiving treatment on country alleviates loneliness, lessens stress, and gives chronically ill people the benefits of cultural protection. And it allows people who can stay on country to continue to fulfil their role in the community and contribute to its continuing culture. They receive both medical treatment and the benefits of being culturally safe and included on their own land.
Purple House started life as a Kintor clinic in 2004. The goal, which is still current, was to allow kidney dialysis remotely so Indigenous communities could stay on country. Purple House is entirely run and owned by Indigenous Australians. This model of care, based around country, family and compassion. Now 21 years old and has moved to Alice Springs and now has 2 mobile dialysis units called Purple Trucks and 21 remote clinics, which you can see here on the map. Support has also expanded to include respite support for patients needing to go to Darwin and Alice Springs. The Purple Truck provides support called Return to Country, which helps patients get home when needed while still receiving dialysis. And Malpas, translated to Friends for the Journey, help patients deal with the healthcare system. Services now include NDIS, primary healthcare, and a growing enterprise hub. Support and education is provided in a way that is culturally safe. The Purple House intervention is in the form of hemodialysis treatment 3 times a week for as long as necessary. The remote clinics, this is the opening of the Cooper Peter Clinic, and the mobile clinics, here is a Purple Truck, help patients deal with the depression and isolation that having to leave their communities can cause. This allows elder leadership to continue in communities and families to stay together. Has the intervention been effective? Purple House itself reports that survival rates for dialysis in Central Australia have moved from being the lowest in Australia to the highest. Unfortunately, data could not be found to support this, with data from ANZ Data, the Australia and New Zealand Data Registry, reported through the current Northern Territory Kidney Plan, suggesting otherwise. This graph shows not only the prevalence in the Northern Territory, but that it's still increasing. What is encouraging though is a review of kidney health of Indigenous Australians in the Northern Territory found mortality rates per 1,000 people, age standardised, dropped by 30% between 2014 and 18. The fact mortality is dropping may contribute to the increase in this as data, as more people are still alive to count. Has this program contributed to closing the gap? If so, in what way? Well, it's contributed to closing the gap on 3 outcomes. So outcome 1, everybody enjoys long and healthy lives. Look, there's still a huge difference in life expectancy. However, the review of kidney health among Indigenous Australians show mortality is decreasing for kidney disease in the Northern Territory. So I think more specific data is needed. Outcome 16, cultures and language are strong, supported and flourishing. Allowing patients to stay on country as much as possible can only contribute to culture positively. The new translation app, Wanga Kitju, the first real-time sentence translator from Pitupi Marija to English, is helping to keep language strong. And outcome 17, people have access to information and services enabling participation in informed decision-making regarding their own lives. Purple House offers education, targeted support for unique needs living remotely, and has an app to aid communication and digital literacy. Suggestions going forward, look, just more of the same. More remote clinics, more Purple Trucks, and expansion of territory covered allowing more people to be helped while remaining on country. This program also shows the benefit of giving Indigenous Australians control over their own outcomes in terms of health and allowing them to make decisions that are in their best interests. Perhaps this self-determination that has developed here is worth bringing into other areas of not just Indigenous health, but Indigenous life.
Here are the references for our assignment.